This is ACEP's Capital Minute, a look at what's happening in Washington, D.C. right now that's affecting emergency physicians and patients. I'm Laura Worcester. ACEP and the Medical Association of Georgia filed a lawsuit against Anthem's Blue Cross Blue Shield of Georgia in an effort to get the company to stop its controversial and dangerous emergency care policy that retroactively denies coverage for emergency patients. Anthem implemented this policy in Georgia as well as 5 other states, with the possibility of more coming. According to the lawsuit, Anthem of Georgia violates the prudent layperson standard, a federal law that requires insurance companies to cover the cost of emergency care based on a patient's symptoms, not final diagnosis. Additionally, the suit contends that Anthem is also violating the 1964 Civil Rights Act because denials disproportionately affect members of protected classes' access to emergency care. The lawsuit comes at the same time that United States Senator Claire McCaskill of Missouri released a report that showed Anthem's policy leading to a big spike in coverage denials among emergency patients in Georgia, Kentucky, and Missouri. Anthem ultimately overturned the majority of denied claims that patients appealed, but the insurer is still putting lives in danger as it continues to tell patients their care in an emergency department may not be covered. To read the full lawsuit and the McCaskill report, go to this link and stay with ACEP for any updates as it moves forward. ACEP is supporting a recently introduced bill that will protect emergency physicians' rights to due process in the workplace if they are employed by a third party. The bipartisan bill was introduced in the House earlier this month by Representative Chris Collins of New York and Congressman Raul Ruiz, who is an emergency physician himself. The bill would protect the ability for emergency physicians to strongly advocate for patients by avoiding the mandatory waiver of due process rights that many emergency physicians are forced to comply with as a condition of employment. ACEP was directly involved with the drafting of the legislation, an effort that also coincides with the letter sent in June urging CMS to protect due process rights for emergency physicians that was signed by ACEP and other leading emergency medicine organizations. If passed, this bill would strengthen the voice of emergency physicians and add an important workplace protection so that any concerns about patient care, safety, or other issues can be addressed appropriately. To read the bill, go to the link at the bottom of the screen. The Centers for Medicare and Medicaid Services released a proposed rule outlining changes to how Medicare pays for outpatient services provided by hospitals and ambulatory surgical centers. As part of this nearly 800-page rule, CMS is expanding its site-neutral policy by proposing to pay the same rate for office visits, no matter if they are provided in physicians' offices or in hospital-based outpatient settings. While this policy would not impact services delivered in emergency departments, it demonstrates CMS's commitment to, in their words, control unnecessary increases in the number of hospital outpatient department services. CMS is also proposing to reduce payment for 340B drugs for all hospital-owned off-campus outpatient settings. Previously, some of these were exempted from these payment reductions. As well, it introduced several new policies related to pain management. To see all of the details, go to the link at the bottom of the screen. The House of Representatives overwhelmingly approved the Compromise Fiscal 2019 National Defense Authorization Act this week. Of particular interest to emergency physicians, the bill includes a provision sought by ACEP that requires the Department of Defense to share controlled substance prescribing information of military members and their families with state prescription drug monitoring programs. ACEP worked closely with Representative Mike Turner from Ohio to establish this new program that will help ensure safe prescribing for members of our military and their families. The House Energy and Commerce Health Subcommittee held 2 hearings this week on important healthcare issues. During the first hearing, the subcommittee heard from National Institutes of Health and the FDA about their ongoing efforts to implement the 21st Century Cures Act. While members were questioning the witnesses, Representatives Brett Guthrie and Larry Bouchon engaged FDA Commissioner Scott Gottlieb about drug shortages. ACEP worked with Congressman Guthrie recently on a letter sent to Commissioner Gottlieb that LAC attendees and ACEP 911 advocates helped get 100 House members to sign on to that urged Commissioner Gottlieb to establish a task force to examine the root causes of drug shortages and seek solutions. He has since announced that the FDA will do this. The second hearing focused on MACRA and MIPS. Several representatives of physician organizations and medical groups discussed the status of these programs and some of the continuing challenges that physicians and other providers face in complying with them in order to be eligible for reimbursement bonus payments in Medicare. ACEP worked with the subcommittee chair to inquire about the impediment to accessing hospital data and how that has negatively impacted our ability to participate fully in MIPS as physicians. ACEP participated in a roundtable discussion on healthcare price transparency initiated by Senators Bill Cassidy, Mike Bennett, Chuck Grassley, Tom Carper, Todd Young, and Claire McCaskill. Among the other represented organizations in attendance were the American Medical Association, the American Hospital Association, insurers and brokers, and patient advocates. This is one aspect of an increasing interest on the part of Congress to identify ways to help consumers better understand healthcare costs and improve their ability to access their cost-sharing obligations before seeking or receiving treatment. That's ACEP's Capital Minute from the last week of July 2018. I'm Laura Worcester. Thanks for joining us.